Hi class, welcome to your very first online module. Today we're going to be finishing up child nutrition and then going over a case study. So, thinking back to last class, we were talking about foods that should not be given to infants before their first year of life. Milk was the main food that is very frequently given that we want to hold off on giving, and the main reason is that it is very frequently related to iron deficiency in kiddos under a year. That's because cow's milk is really low in iron, and excess consumption of cow's milk can start to displace other nutrients that are more beneficial to children. So in addition to cow's milk, breastfeeding after 6 months without iron supplementation can increase a kid's risk. So breastfeeding is recommended exclusively for the first 6 months, but then you want to start incorporating foods that are high in iron. The most common food is an iron-fortified cereal. And the reason you want to do this is that the iron stores a child was born with have slowly started to fade and now need to start being built back up again. So in addition to iron deficiency, food allergies are one of the biggest and most up-and-coming problems we see in kids. Although genetics are the main factor in food allergies in kids, there are some things that we can do to help minimize the problems we see from food allergies. So one thing you can do is encourage breastfeeding, because we do see that infants who are breastfed more often are less likely to have food allergies later in life. And this could be for a variety of different things, possibly the different bacterial exposures, possibly that immune factors are spread from the mother to the child. Again, we're not really sure, but we do see very consistently that food allergies seem to be less prevalent in breastfed infants. Another big strategy you can use to decrease or at least single out food allergies is to introduce foods very slowly. This is when you introduce one food for 3 days, and then a new food the next 3 days, and then a new food the next 3 days, so that you're really able to parse out if a child has a reaction to exactly what food it was. So often kids are consuming mixed foods where you don't necessarily know what the ingredient was that caused that reaction. So again, breastfeeding and then the timing of foods is how we seem to be able to monitor food allergies the best in infants. When you're looking at the programs that serve this unique populations of mothers and infants, WIC is the gold standard program. Gold standard in that it is the most efficient program that's been undertaken by the federal government when it comes to maternal and child health. If you think back to some of our other talks, you'll remember that WIC is federally funded but administered by the states in what we call a block grant. So Texas receives a set amount of money and then decides how exactly to split it up and the services that they want their WIC to offer. Here in Texas, we provide monthly vouchers or checks for food in the form of an electronic transfer card. This is not the same card as a SNAP card, but it is a very similar process. We also offer nutrition education and counseling all the way from pregnancy through childhood. The other thing it does is give screenings and referrals to other healthcare services. To be eligible for this program, you do have to meet certain poverty threshold limits and have some type of problematic risk factor. These can be broken down into medical, nutritional, or addictive risk factors. Medical risk factor could be something like anemia, while nutritional is poor access to healthy foods, and addictive behavior might be something like alcohol consumption or smoking. So any of those factors would qualify you for this program. And really what I want to emphasize is that we do see this program seems to really improve outcomes. Of all of our governmental assistance programs, WIC has been questioned the least on its efficacy. So even though it is very effective, we do not meet we have gaps in WIC coverage. So in Texas, about 66% of eligible participants are enrolled in WIC. It ranges all the way up to 82% in California, all the way down to 45%. And I believe that's Arizona. So we do have some room to grow. So we do have some room for improvement, but it's not something that should be overlooked. We are doing a good job. We just still have some room to really expand our coverage. Some of the other programs that also assist mothers and infants are the SNAP program. So although this is not exclusively for mothers, it does help. One that's kind of unique right now is this Commodity Supplemental Food Program. Prior to 2014, this program was specifically focused on directing commodity foods from distribution to these populations that need it. It was intended for pregnant through breastfeeding women and the elderly, but in 2014, it was restricted to only the elderly. So if you were enrolled in this program prior to 2014, pregnant women through breastfeeding women were still able to receive benefits, but since then it's been restricted to the elderly population. The Expanded Food and Nutrition Education Program specifically addresses nutrition education. It does not offer additional foods or services, but it is purely for nutrition education. But it does provide some services, particularly in clinics that don't have a lot of access to dietitians. Trained professionals will come in and do really good educations for the community. And the last, and I think really important program, is the WIC Farmers Market Nutrition Program. So this is an extension of the larger WIC program, and you receive coupons to purchase fruits and veggies at some of your local farmers markets. The reason I think it's important is that we've seen after implementation of this program, there is a 5% increase in fruit and vegetable consumption among participants. This is not a program that is mandatory by WIC. It is different by state. So here in Texas, we do offer both a farmers market nutrition program for WIC participants and also a seniors variety of this program. So that's what you'll see in the purple are states that offer both of these programs. What I think is great about this map is there is a lot of purple, but there's also some places where there's not purple. So there is room for improvement that we would like to see across the country. Another big component of maternal and child health is Title V. Title V is a program that tries to ensure the health of mothers, infants, and children through this joint administration of programs across both government and state agencies. This was established by the Social Security Act, I believe of 1933, to really ensure the health of kids as they grow. Because of Title V, each state must have programs for maternity and infant care, intensive infant care, family planning, and health care for children, and dental care for children. The reason I italicize these bottom two is that is often where a big focus of these funds go to through some of our screening services we have. Again, Medicaid is a huge funder of pregnant women and children, which is why it's up here again, and it is that state-administered entitlement program that helps support health care of those unique populations. Within Medicaid, there is an early periodic screening, diagnosis, and treatment test. This is mandatory across all states to improve the health of children. So it is this true early periodic screening and diagnosis test that kids are given. So if you think back to your elementary school days when you got hearing test or vision test or had the nurses check you for random things, that was this early periodic screening test. And it is really beneficial for those with children or expecting children because it can identify problems much earlier than you would normally if it was just through general treatments. The other big program that helps mothers, infants, and children are the Healthcare Center program. This again is not exclusive for benefiting mothers, infants, and children, but it dramatically helps them. So this is the primary way that federal money is given to healthcare centers to support community clinics. If you've ever heard of the term FQHC, that stands for Federally Qualified Healthcare Center. These are centers that meet very specific criteria, such as being located in areas of decreased access, or they may serve a really unique population. Another really unique piece of FQHC is that they have to be run by a membership board, and of that board, half of them have to have been recent patients at those clinics to really give them a stake and true outlook on the clinic. These clinics do also receive special funding for Medicare, Medicaid, and CHIP, which is really helpful in some of the reimbursement services they receive. So looking ahead to what we need to do to improve mothers' and their children's outcomes is a big focus has been on nutrition education and counseling. We need to make sure that it's available and accessible. So through potentially online education pieces, through grants that will help hire public health nutritionists, to helping coordinate organizations to make sure we're putting our efforts in the right places. We also have a big focus on increasing Medicaid funding and reimbursable services for pregnant women. So through Medicaid and in private insurance policies to make sure the really critical time of pregnancy is covered during nutrition education and counseling. Okay, so now you can switch over to your case study that you'll find just following this lecture.